Is care for people with back pain in Somerset better than care for people with back pain in Devon or Durham? We can't answer these questions. In fact, we can answer very few questions of significance with the NHS. Is care for epilepsy better in Liverpool or Manchester? Who's responsible for asthma care in Birmingham? How many asthma services should there be for England? Is it one for every practice? 200? 500? I don't know, but we should know. How many back pain services should there be? What do I mean by a back pain service, and why are we asking you to give your time to this exercise? A service is a system, we sometimes talk about, is a set of activities with a common set of objectives that serves a population and has an annual report. That's what a service is. It's population based. This book, Trying Hard is Not Good Enough, is a fantastic book. It's not about healthcare, it's mostly about education, but it's about the difference between institutional accountability and population accountability. Accountability of an institution for delivering high quality care to those patients who happen to have reached it, and population accountability. The accountability for the quality and value of services offered people with back pain in Somerset. Now, for some health problems, it isn't a big problem. For example, the reason I'm not with you today is I've had to change my arrangements a bit because I've been off sick a bit with an acute MI and a stent. But I can tell you, there was never any doubt that I was going to go to hospital, assuming I survived. So, all stents, all MIs reach hospital if they survive. Same with broken legs. But most of healthcare isn't as simple as acute MI or broken leg. Headache, chest pain, back pain, or even with diagnosis, rheumatoid arthritis, osteoporosis. These are all problems in which this mixture of self-care, informal care, generalist care and specialist care is all mixed up. Now what we would like you to do, and we're very grateful for your time, is to design a system. How many people are there with back pain? Which brings up the question, what do we mean by back pain? What's the case definition? Of those people, how many are known to generalists? How many are referred to specialists? What's the variation in referral? How much are you spending? If you had all those resources under your control, which you do have, what would be the best value use of those resources? I would like you two to think about the objectives. What are the objectives of a population-based back pain service? Then we'll need to define criteria to measure progress towards the objectives, or lack of it, and then set standards. That's what we'd like you to do. You're the first people ever to try this, and it's really great you're doing it. I'm very sorry I'm not with you, but we can be sure this job won't be finished in one afternoon, but we can also be sure that one afternoon of people working in a real population with money and limited resources, not people sitting in the Department of Health in some nice meeting room in London, this is the way to address these issues. Do once and share is our principle. We're grateful to you for doing this, but round England, other populations will be addressing other problems, and you'll benefit from their work. Thank you very much, and I look forward to seeing you again.